With all of the success that you've had, what have you learned through that journey?
Despite a lot of what I think people would define as success, I still feel like, gosh, there's more I can give, and there's more I can do, and there's more people I can help. And I think that ultimately that's kind of the drive that maybe takes me to more places. I would also say a lesson that I've learned is that I really need to take a pause sometimes and just like celebrate the wins. I remember asking our CEO, Jeff Martha, what the three kind of most important traits of a good leader are. He said one of them is humility, the others being clarity of thought. The third one was purpose. My advice would be, check in with yourself, do a lot of soul searching along the way. You will evolve as a human being, and your path doesn't have to be the same one forever. If you're interested in a certain path, you can do that for a while, and then you can pivot, or you can take that expertise and apply it in a different way. You might be so pigeonholed into a certain path, and you might have your blinders up and not be as receptive to other ideas or opportunities that might come your way. And so just be open to that and be open-minded.
Austin Chiang, Chief Medical Officer of Medtronic, Associate Professor, and GI Doctor. Welcome to the podcast.
Thanks for having me on the pod. I'm so excited.
I'm so excited too. Yeah, it's great to meet in person because we met 4 years ago.
Yeah.
Via phone call because of social media.
It's been a long time coming since TikTok.
And now we're here today. But before we get too far into it of talking about all the great titles you have, I want to get to know Austin on a more personal level.
Okay.
And so, Austin, tell me a little bit more about yourself before you ever decided to go to med school.
Wow, where do I begin? I grew up in Southern California, and then one interesting thing about me was I moved to Taiwan when I was 10 years old. So I spent middle school and high school years abroad, and then went to college at Duke, majored in biology, minored in music, which is a little different there. And then moved to New York for med school and residency, and then went to Boston for my GI training. Got a master's in public health, which kind of also played into everything we can get into later. Yep. And then ended up specializing in interventional GI and bariatric endoscopy. And then not long after, really, of being full-time, academic faculty, I ended up joining Medtronic. So it's been quite a journey.
Yeah, just so you know, that's why I'm so excited, because you've had an amazing journey, and it's not the typical journey that I think most people think about when becoming a doctor or a surgeon. And so where I really wanted to start was, what made you actually decide you want to be a doctor?
There are a lot of influences, I'd say. My grandfather was a surgeon in the World War II era, but he actually passed before I was even born. So I never even met him, didn't really know much about that history, but medicine kind of was in the family. And two of my cousins are also physicians, and several of my uncles. So my two cousins who are doctors, I think they, were role models. One is a plastic surgeon, one is an ophthalmologist, and so I'm the baby of the family. So I always kind of like looked up to them. And then from there, I think there were several experiences growing up where I had the chance to volunteer at hospitals and nursing homes, and I credit my parents for, I think, giving me that exposure. And ultimately, when it came to deciding on a career, I felt like it was a good kind of union of my personality and my interests. But even going into college, I really treated college as kind of a playground to explore all the different potential career paths, and ultimately decided on this. Yeah.
Yeah. And so when you talk about biology and then music, how did we get to I'm a GI doctor? Like, to talk me through you going to school and then how it kind of led to that.
Yeah. So when I decided on medicine, I didn't have a clear idea of specifically what specialty I wanted to pursue. And I think that was great because I went into med school with an open mind.
Yeah.
And I think, looking back, I really wanted to go into something procedural. But again, I kept an open mind and really did enjoy rotating through all the different specialties. I think for a lot of people who don't know, our third year of med school is sort of when we rotate through all the required specialties, and then you can kind of go into other more specific ones that you're interested in later. But But I thought at one point I was going to do orthopedic surgery. I thought I was going to go into plastic surgery. At one point I thought maybe, neurology and cure Alzheimer's. But ultimately I went into internal medicine because I really admired the residents that I worked with. And so it really was the culture and the personality that kind of pulled me into that field. And I thought I was going to go into pulmonary critical care, which is kind of working in the ICU and treating lung disease. And then pivoted as soon as I went into residency toward going into interventional cardiology. And then I noticed all my friends were going into gastroenterology, oddly enough, and I never considered it as a area in medicine that I was considering, and said, I think I want to go into this, particularly because of the technology and the innovation that was happening there, because it was just moving so quickly, and there were so many cool things that were being developed in that space. So, yeah.
No, that's what I love about it, is because we talk to so many different people that are actually in medical school that actually are considering medical device sales. But we also have a lot of people who come to us in college and they're like, hey, I might go to med school. I might not go to med school. Can you just help people understand why you went to medical school and you made that next step, and then maybe some of the challenges you faced? Because the one reason I really love this is most people think when you go into something, oh, it's just easy. But everyone who's made it to the top has gone through challenging times. We've all probably thought we're going to quit at some point. But tell me a little bit about that story of you actually deciding to go to medical school and some of the challenges you faced during that journey.
I mean, to be honest with you, I think I wasn't 100% certain to begin with. I sort of, leaned on friends who were also pre-med and tried to, get exposure in college to, the hospital environment and what doctor life was really like. And I think part of it, looking back, was driven by some degree of ignorance, which is probably a good thing. But I ultimately chose actually kind of the practice of medicine because I truly cared about patients and wanted to be more hands-on with it. And there's a lot of different ways to do that. So like you were alluding to, being a doctor is not the only way to have an impact. You can certainly, there are other clinical, areas and roles that you can go into. You can go into med tech. You can go into other sort of, healthcare is so complex and there's so much that plays into what makes it run and makes it work. So you can still have an impact in healthcare without needing necessarily to become a doctor. And it's a long, long process, many years, so many exams, board certifications. And truth be told, a lot of doctors today are suffering from burnout. And are considering different paths. And so it might not be right for everyone.
Yeah, no, and that's such a good point, because we actually have physician assistants and doctors actually reaching out to us that are considering medical device sales, which is very interesting. And that's why I asked that question, because I think a lot of times we get told many things that you have to do this way, or, hey, med school's for everyone, or medical school, like you should already know your specialty.
Right.
And I'm really wanting to talk to the people that are considering it. And I want everyone to hear that the chief medical officer of Medtronic went to med school, not all in, saying this is 100% what I'm going to do.
No, not at all.
Because I think that's such a big point, is even now we talk to people that are in their career and they feel like they should have it all figured out. We're always all learning. You're always going to the next step. But you went into medical school, and then you went into a lot more schooling and specialty and got to where you're at. And like you said, you chose the GI route. And you said innovation. You saw what was going on in the space. What about that space really drew you and a lot of the colleagues that you know and friends to that space?
Well, I think for a lot of people who don't know about gastroenterology, there's a lot of different subspecialty paths that you can take in there. There's general gastroenterologists who are the vast majority of gastroenterologists out there, but there's also specialists who focus on certain disease states, or like the liver and liver transplant, or advanced endoscopy is what I ended up going into. And that space is really, I think, the tip of the spear when it comes to making certain procedures less invasive and thinking of ways to get into areas kind of through natural orifices, what we call it. So either the mouth or the anus. And spare people having to get incisions and external scars. So that's really what intrigued me. And I think we, at the time, and there's been so much progress that's been made, in being able to, take that approach. So that's really what intrigued me and got me into the space in the first place.
Absolutely love it. And I think that's the one thing that I love talking to so many different specialists and also people just in their careers is you find something you really love and then you just keep going deeper inside of it of seeing what's going on and where the technology is taking you. And for you, when you look back when you first started to where technology is today, what's been the biggest change?
Ooh, the biggest change since technology then. I think I think we're just starting to see the impact of AI, for instance. I think that's a huge revolution just not even within healthcare, but everywhere.
Yeah.
So I'm excited to see where that takes us and how that improves, potentially clinical outcomes, our efficiency. So there's a lot of different ways I think that things will shift. But yeah, just I think new fields have emerged kind of within gastroenterology as well, and new techniques and new procedures, and even just in a short few decades, we've gone from being able to take things that used to be open surgeries down to something that is much safer, much more efficient, and hopefully the trend continues.
Yeah, and that's the exciting part about the trend is I think when you see technology and you can use it and continue to work with it, I think for patient outcomes, it's going to be really exciting for us. And, I always talk to people about, they'll ask me, hey, won't AI take over everything and all this stuff? We're still going to need reps. We're going to still need doctors and surgeons. But I think we're in an exciting time where healthcare is going to go to a different shift in a couple different ways.
I believe so.
Yeah.
I think if AI is developed responsibly and there are proper guardrails, then I think it can really enhance what we currently do.
Yeah. And I'm really excited to see where it goes. But I actually wanted to talk to you about, you said something earlier when you grew up, you went to Taiwan. Tell me about how you feel growing up somewhere else instead of the United States the whole time, and that experience there maybe helped you see the world a little different.
Totally. I mean, that's such a great question. I think that just having the exposure to how things are done differently elsewhere, again, healthcare system there is very different. It's a single payer health system. I saw the pros and cons of that. I just knew that I think it shifted the way I think about any situation, that there's more ways than one to deal with an issue. And certainly I think with my own career, it made me rethink that nothing was always black or white. There's nuance to everything. There's a way for me to approach my career and still not give up, the things that I enjoy, be able to integrate other things and introduce new ideas. And so that sort of ability to, kind of take a different perspective, I think was the ultimate result of that move. So I'm super grateful for that. I mean, there's also the kind of very tangible benefits of picking up a new language and, developing, relationships there and whatnot. And so I'm super grateful for that.
Well, I think there's so many benefits that come from just seeing a different culture, seeing how different places ran. Because when I was younger, I never left the country. And then because of medtech and medical device sales, I actually started getting to travel for work and going to the UK, right? Going to Greece and just seeing different parts of the world. But also when you're there, at one point I had to go to the NHS when I was in the UK. And so you see how things are ran differently. And then I talked to my colleagues there and they're telling me how it's being ran. And then also there's still private insurance and you just start seeing things differently. But I also just am saying this because I want to encourage a lot of people is I think a lot of times we get very comfortable where we're at. And one of the best things that I always encourage everybody is to go travel somewhere new and get out of your comfort zone and really go somewhere where they maybe don't speak our language, because you just learn so much about different cultures, which I've actually always seen to make me better at what I'm going to do in the future. And I think one thing I just want to put out there is I've noticed when I travel a lot, sometimes I'm like, maybe I'm overdoing it here, AKA go to Italy, and they don't work the culture of us. But also from that downtime, I've actually seen the benefits of they actually get time to rest and they actually get time to think things through compared to, I think many times when you're so driven that maybe you don't see all of the opportunity that's actually there, or we're so caught up in our own how we think. And I love going to somewhere new because it challenges your belief system.
1,000%.
And sometimes being challenged isn't totally a bad thing. But I think that's one thing I just want to encourage everyone is many times we get taught, you need to believe this, and this is how you should always believe it. But why I say it's so important is because in medicine, in med tech, in medical device sales, in surgery, it's always evolving.
Mm-hmm.
And we always need to be looking what's the best opportunities coming and what's the best procedures and best products and what's going to be best for the patient outcome. And I say that as a rep who I've talked to surgeons who've used the same techniques for the last 20 years or the same things for the last 20 years, even though we have all the new advances because they just do it because they've done it that long.
Yeah.
And I always want to put that encouragement out there because even for my young people, I think traveling is one of the best things you can do.
I'd echo that. I mean, I think the value of travel is totally underestimated. And like you said, I think especially in medicine and healthcare, we're often put on this assembly line and you think that you have to follow, that blueprint to a T, otherwise things won't work out. Or, and especially I think in medicine, like you said, it's so fast paced. When I think about my doctor colleagues, the decisions that are being made are often of the moment and you're not strategizing for months down the road. And in my kind of dual role, kind of corporate and, clinician, I've noticed that difference even there. So being able to take time, slow down to move faster, I think that that's really something that, that a lot of people would benefit from. But yes, travel I think is so important. I actually just got back from Antarctica, which is wild to say. It was so fun, but in the moment I also learned from that trip that, when I was there was so much happening there with the wildlife that it really reminded me that, even though I'm here doing my own thing, answering emails, being in meetings, there's all this happening over there in a different part of the world.
Yep.
And I mean, that, is the same with all of us, like human beings. It's not just the wildlife. Yeah.
Yeah. And I think that's a good point because we were actually on this trip. We're here in New York recording this.
Yeah.
And my team will hear me say, guys, look at how different it is here. Look at the opportunity here. Because I think what many people do is they just go into their own world and their own life and we don't see all the other stuff going on, right? And you go to all the conferences, if you even knew about half of the conferences, you'd be like, wait, that exists? And I think that's such a good point is like the traveling piece, it just makes you understand there's a lot more. And we put so much on ourselves that it has to be certain ways.
Right.
And I think a lot of times if you just challenge what has to happen, you might see life a little differently.
Totally. Is this your first time in New York, by the way?
This is my first time in New York.
Isn't it mind-blowing?
It's absolutely crazy. And it's even more fun that we're getting to record in the Empire State Building where it's like
very special.
It's a very special moment and it's very cool to be here. I'm very honored to be here. And thank you for making that happen.
Oh, of course. This is so exciting, even for me.
Yeah. But even for you, when we talk about travel, right? I do want to ask, you just went Antarctica.
Yeah.
Where's been your favorite place that you've traveled or a place that you had the favorite memory?
Oh my gosh. I think, Antarctica is hard to beat because it's Antarctica.
Yeah.
And it's so fresh. And, I've touched many places that I feel like I could really, go back to and explore more of. I will say it's been a while, but I visited Turkey, which was really awesome because it's really where the East meets West, where Europe and Asia come together. And you can totally see that and the history there, that there are different buildings that kind of reflect that. And they also have some really awesome terrain there. So I would probably say that. Yeah.
I love that. No, I've actually never been. I was actually just telling my fiance we should look at that because I'm like, also I see they have a lot of different healthcare options. And it's always just interesting. I love to see different healthcare in all the different sides of the world because I think it just, again, goes back to challenging and we get so brought into what we're doing in just the local areas.
Right.
And so I think it's really great what's going on. But now I want to talk about, you've done traveling. You maybe didn't do what everyone else has always done in the medicine world and medical world, because that is to be said because you're a chief medical officer, which not a lot of people get to be, but you're also a professor.
Mm-hmm.
Talk to me about that, how you're able to be a doctor, be a professor, be chief medical officer.
The path to that was an interesting one. It was not anything I expected at all. I think I would like to say, being active on social media, I always subconsciously wanted to reach or have an impact at a population level.
Yeah.
And that really was what motivated me to get on social media in the first place, was education and, combating misinformation and kind of giving more of a glimpse into kind of what we do. And ultimately, social media, among many other things, like, the actual clinical expertise and whatnot, played into me being contacted by my former boss who hired me. And he basically, I had not known the man, never met the guy before. And he contacted me out of the blue and asked if I'd be interested in considering the role, because there hadn't been a chief medical officer for the endoscopy division at Medtronic. And, I was pretty junior in my career. And of course, I was just so floored that this would even be presented to me.
Yeah.
And having been interested in innovation and technology, as part of my decision-making within medicine, I was definitely open to it. But I said I really wanted to continue practicing still to a certain extent so that I could, not only maintain my credibility, but understand how things were evolving in the field and just have a closer, relationship to, reality and what was going on. So we made that work. And I'm still able to practice. I'm still, I'm able to kind of be full-time at Medtronic as well.
Yep.
And do everything else that I like doing and, that I've developed over the years.
I'm still trying to figure out when you sleep because you have so many different things that you do. And again, like you said, just making an impact on people. I think that's one of the things that I'm so excited to talk about today is people know you in the space because of the information you put out and how you carry yourself too. Because you carry yourself in such a respectful manner, but also a personable manner where people feel like they can connect with you. And let's talk about, you said social media, right? That's how we actually met, was we met through social media. And we talked 4 years ago when I was still working at Medtronic, and we were talking about what social media is doing and where it's going. And you've continued to build an amazing brand through yourself with social media.
Thank you.
Tell me a little bit about the decision to get on social media, because I know a lot of people, especially surgeons, doctors, or people in the medical space, are really hesitant about getting on. So tell me about that decision to actually get on social media.
Yeah, I think first and foremost, I never want to force anyone to do something that they don't want, like put themselves out there, because I know there's a lot that goes into that decision.
Yep.
I personally never thought that I would be so out there as I have become, but it's been over a decade in the making. So, again, it was driven truly out of a curiosity of how the general public receives their medical knowledge. And so I spent some time, there's a rotation that you can do, I think it's still in existence, where you can go spend some time at ABC News behind the scenes as part of the medical team. And I learned how the news was vetted and, who gets to decide what big study gets featured on the news. And then from there, I thought, okay, maybe one day I'd be able to be an authority in some way on social media, or at least share my experience, going down this journey. And I started with Twitter at the time. There were very few doctors in my specialty on Twitter at the time. And I knew, if I had to be honest with myself then, I wasn't an authority at all, but I was there to share kind of what I was learning. And I noticed that there were patients who were tuning in as well. And, whenever we had a big conference, they were also paying attention. And I thought, wow, I obviously could see outside of medicine the impact that social media was having, the reach that it was having. And I thought, why, if these celebrities and influencers could do something outside of medicine, why can't we harness the same type of influence for healthcare as well? And so that sort of is what sparked all of this. Started on Twitter, then eventually was an early adopter for Instagram and YouTube and TikTok. And I started on TikTok in 2019. And I think what really, really catalyzed this whole thing was the pandemic. And so everyone was on their phones, and, And that's what I think convinced a lot of folks within the medical community that social media truly could drive, decision making, could really have a public health impact and an impact on how physicians and clinicians are perceived. So yeah, I think that now it's almost a given that healthcare and social media have some sort of intersection.
Yep.
I think that there are still ways to harness it tangibly to actually drive a certain purpose, and I still believe in that.
Yeah, and when we look at social media, you're spot on for the fact of it's here to stay inside of the medical world.
Mm-hmm.
A lot of people are trying to figure it out now and where
Yeah.
to go with it. And I think what I see in the space is because that's why we connected. It was the same thing for me. I'm like, hey, let's start putting stuff out there. You see influencing, and I came from the fitness world. So everything I'm doing was already being done in the fitness world.
Yeah.
And I was like, how would I just bring it into the medical world, the medical device space? I started doing it and started getting traction, just like you're saying. But what I think is interesting now is most people actually don't even understand the social media game for the fact of they think, oh, I just post and that's going to make something happen. But what I want everyone to hear is you didn't just put things out to just put things out. You put things out because it's what you were learning.
Mm-hmm.
And then what was happening, it was providing value to other people. And then actually patients thought it was valuable. And then it grew to this where it's at today. And I think that's one thing I really just want to put out to everybody is we're going to continue to grow inside of the healthcare world of social media. There's many surgeons who run their practice off of social media, but I don't think many people actually understand a lot about social media. And I think we're going to see that change over the next 10 years, especially in the medical world and medical device companies, because they're starting to see that there is a play to be used here.
Yeah. As people get more digitally savvy, whether it's the practitioners themselves, whether it's the patients, the general public, I think we'll see more of that. I think that ultimately it's figuring out what you want to do on social media and who your audience is. And I sort of have understood that, on different platforms, I have different audiences. And so I gear the content in a certain way to, deliver a message for that audience. And I think that, not everybody has the same purpose of being on social media. Some people just want to do it for fun. Some people actually want to drive business some way, if it's a surgeon wanting to build their practice. Some people want to educate or advocate, and so there's not a one size fits all approach, but there's a way I think to really enhance whatever you're trying to do through social media for sure.
Yeah, and that's such a great point. Is like you said, not everyone's going to be on there for the same reasons. And I think it's kind of funny when you and I were talking off air. It's more of we just wanted to help people.
Yeah,
we just wanted to put stuff out that hopefully it was helpful, and then it's turned into what it is for both of us today.
It'll like sort of amplify because then I started getting all these other opportunities of like speaking engagements, a book deal, yet another way I think I could, kind of play out my goal of helping more people and, having that population level impact. And similarly within med tech, I think that was yet another avenue that I didn't ever imagine that social media would help in any way, I guess. And then now I feel like there's ways to even influence that.
Yeah. Well, that's the fun part of even just seeing the power of LinkedIn, right? I always tell people, especially in medical device sales or med tech, if you're not on LinkedIn, you don't exist. And so we have to understand of just like you said, there's different audiences on different platforms and who you're going to. But the power of social media is, I think what's super special is we talked 4 years ago and today we meet in person. And so it's like you can actually get to know people and you can create relationships and see where things go for everybody without actually ever even meeting somebody before we get there. And so I think that's what's super special about it. But let's actually talk about now Chief Medical Officer at Medtronic, which is the largest medical device company in the world. Pretty big title. When we talk about, when I say that out loud, what actually comes to mind when you actually hear that title with Austin Chiang?
Oh gosh, I mean, I think it's a bit surreal. I really see it as a privilege, and at the end of the day, my day to day is very normal, and I still feel like, day to day, I'm not thinking about what my title is. I'm just trying to get work done, trying to help folks at the end of the day, and provide my expertise. But I see it as a privilege and an opportunity to truly drive the future of of medicine in my specialty, maybe beyond that. And so, yeah, that's what I really think of it.
Now, for you in the next 5 years, I always like to ask, what do you think you're the most excited about in the changes that could happen? And what I mean by that is, I was going to ask you 10 years, 15 years, and then I was like, I might have to bring it down to 5 or even 2 because we're moving so fast and there's so many changes. But what really over the next 5 years are you the most excited, just even in healthcare and medicine as a whole?
Yeah, I mean, I think that, like once again, the AI piece is just going to totally change how things are done. We're just seeing the beginning of it. And I think robotics as well, is going to be super exciting to see where that all goes. Again, like that sort of ties into AI as well. And I would also say, patient empowerment and patient choice with social media, getting more information, being able to ascertain like what is good information, not so great information, make their own decisions, feel empowered to speak up, with their doctors and say, hey, have you heard about this? Yeah. Or, what do you think about this treatment or this, and make suggestions even, and kind of really be a partner in driving their care. I think that'll be really exciting to see. And also just, I think a lot of my thinking has admittedly been very like US centric. So how do we think about the rest of the world?
Yeah.
And improving access everywhere.
Yeah.
So I know healthcare is always very dynamic and unpredictable, but these are sort of the things that I like to think about.
Yeah. Well, like you said, there's so much that's going around and there's so much that's going on in all the different areas and in the different parts of the world that you guys are just always thinking about, hey, what's the next step and what can we do to even get deeper into that market? But one thing you said I think is really important is I get to watch it firsthand with just people I know of educating themselves through TikTok or other social medias where doctors and other people are putting out information to where they now can go suggest things to their providers. Now, again, I'm going to just make this clear. I imagine a lot of providers are really annoyed by the social media and what they get suggested. It's the new WebMD of somebody Googled their symptoms and is this right? But I also think there's a massive power to when the patient actually wants to educate themselves, because we actually go through this in my own personal life where we have somebody who's going through health issues. It consumes their life. And it's always, what can we do to try to relieve the pain? What can we do to make this better? And I think that's been the most interesting part of this is there's so many people who actually are living it and they actually are pretty educated on a lot of the symptoms they're going through and things because, again, my fiance, she has an autoimmune disease. We've been to so many specialists. We've been to so many different people and they all say different things. And now she's able to go talk with the surgeon to a very high level because she's able to explain what she's going through. And then he's being able to say, yes, this is why, and this is why this didn't work. And there's actually an interesting conversation that I get to sit in the room and be like, I didn't know healthcare was going to be going this way. And I think we're going to see that a lot more. And I think that's something just for the medical device companies to think about is patients are becoming more aware and they want to know more about the procedures and things that are going on for them.
Yeah. And there might be, right, exactly. I feel like there's, if patients are aware that certain treatments are available to them, they potentially will go seek out that procedure or bring it up with a doctor and request it. And as a doctor, yes, I think, I actually do like having those conversations with patients where they come in with ideas and are informed because it gives me confidence that they'll also follow through with the treatment plan. So I think, reframing that it could be helpful too. But, I know from personal experience, talking about procedures on TikTok, I've gotten feedback from my physician colleagues from around the country that certain patients have come to their practice requesting a certain procedure because of that TikTok. And so it really goes to show that, even a single video, a 15-second, spiel about something can really change someone's life.
Yeah, it's the power of social media. And then I talk to a lot of actual doctors and surgeons, and we actually talk about, when we're talking about business, it's a main driver. There's a lot of, for example, plastic surgeons.
Yeah.
Their TikTok, their Instagram, that's their main driver of getting clients.
Oh, yeah.
People will travel all over because they can see the results or people talk about what they're doing. And so I think there's just a very interesting shift happening where many people in medicine probably didn't see it going 10 years ago.
Absolutely. And even I will say there have been a few examples on LinkedIn where I've gotten, messages from folks that they've joined Medtronic because they saw something or they learned about Medtronic through what I was posting. And so for medical device companies or just healthcare companies in general, recruitment efforts, I think it could also be, really helpful in that way.
Yep. People want to be with great companies. And we see the exact same thing. We have a lot of people reach out to us, and then we also get, hey, you talked about this company. Can you give us insight?
Yeah.
So it's interesting. Like you said, there's just so many different uses of it and where it's going. So I really enjoy where it is going, and I'm really excited to see what you all are doing at Medtronic. But now I want to go back to the surgeons that many of them want to start working with industry. I talk to so many doctors and surgeons. They actually talk to me and they're like, hey, how would I go work with industry, work with medical device companies? Can you kind of talk what you've seen and maybe just some advice to practicing doctors and surgeons that maybe want to one day work with a medical device company, or how would that even happen?
Yeah, I think that it's becoming increasingly, more prevalent. I get hit up all the time from doctors or other clinicians who are burnt out and are trying to find other options. And I think it really depends on what they're wanting to do or wanting to get out of a transition. Because, I think some folks say, oh, I want a better quality of life. And I said, well, it depends on how you define that, because you might find that the grass might not be greener based on what you're used to. And then the next step is really thinking about, well, what are you interested in doing within this space? There's a lot, like I said, there's a lot of different ways to have an impact in healthcare. It doesn't necessarily have to be in a clinical trial or running a clinical trial or providing, there's ways to be a health communicator or work in health policy or just so many different options.
Yeah.
So it depends on kind of what your interests are, what your strengths are. I think playing into those strengths is a good way of trying to figure out what might be the best path. And then in terms of, actually getting involved with a medical device company, for instance, I think taking advantage of your relationship with the sales reps are a big way of learning more and getting involved and seeing what opportunities there are through that avenue. I think that, talking to people, in medicine, we're not used to requesting 15 minutes for coffee with folks. It wasn't what I was taught to do, coming through this. And I realized, obviously working, at Medtronic, and I'm sure at a lot of other places, that putting time on someone's calendar is just, routine. And so just asking to have a conversation with folks and meeting people, you'll come across so many different cool opportunities right away.
Yeah. And I think, like you said, we always talk about, it's funny, networking is always going to be your best thing that you can do, right? Whether it's with the reps, whether it's with other clinicians that are already doing it,
right?
And just educating yourself in the space. Because again, whether you're trying to break into medical device sales, whether you're trying to be a KOL, whether you're just trying to work with industry, I think a lot of times most people have a blind approach to it, but then they don't try to educate themselves before they actually get opportunities, right? Because many times what we see is a lot of people might just reach out to a company or just reach out to somebody, but they've actually never understood what would the role actually entail, right? And so I think there's just so much research that people can do in education to make yourself stand out. Because at the end of the day, whether it's, again, us getting people hired in medical device sales or a clinician wanting to work with industry, a lot of clinicians want to work with industry.
Yeah.
So why are they going to choose you over the other clinicals?
Exactly.
And so I think there's just something that can go there. But you also said, talk with your sales rep. So I think this leads perfectly into, from your experience working with a lot of reps, what have you seen the characteristics are of a great rep in medical device sales?
I would say that the reps who don't necessarily see the clinicians as purely kind of a transactional customer, but truly as a partner. And what I've come to realize, honestly, in working in this space is that, look, it's a small world. We can all help each other out in a lot of different ways. even like when it comes to healthcare questions, right? Like reps, if they end up having some sort of medical issue or know someone that needs help, they can reach out to the KOLs or the customers they work with and get answers, get connected. And that's really what the relationship that you're developing here. It's not just a sale. And I've had reps who, have become friends, who have called me with other job opportunities that they've received and asked for my input on that. And that's where, you can derive some benefit from those relationships with your customers, not just, the quarter by quarter, sale. So I think that relationship is really important. And even, providing value, there's a lot that you can provide to the physicians. It's not just the product specs and, features. Yeah. It's even like what you do and what the medical device industry is like from the inside, because before taking on this role, I really had no concept of it. And that's part of the reason what led me to you was that I was going on social media. So again, social media is a great vehicle. I was going on social media looking for, well, what does the day in the life look like? What are the, usual challenges and the cool parts of being a rep, and and sharing that with your, clinician customers, I think is also a really great way to connect.
Yeah, I think one thing is there's a lot of misinformation of what clinicians think about reps, because I can sit here and tell you as a very first year rep how many times I was told, hey, go hang out in your Lamborghini. And I was like, you mean my Subaru Forester? Shout out Medtronic, thank you. But what most people don't understand is there was always like, oh, you're the rep, so your life must just be this way. Compared to, for me, I was a personal trainer before this, and what you said I think is the biggest piece is so many people think of reps or sales reps as, oh, I'm just a money-making machine for them. Compared to if you actually just get to know your doctors and your surgeons. For me, what I always teach our people is when I was the new rep, I sit down with every single surgeon if I'm able to get some time, or I do it at the scrub sink or when we're working together, or I go to all of my accounts and talk with the head person I'm going to be talking with. And I sit down to get to know them.
Yeah.
And I learn about the last rep and what they enjoyed about that last rep and what they did not enjoy about that last rep. And then just get to know what they're really looking for and what would make their life the easiest. And that way I could be able to go show them, because I think one of the biggest things is reps love to be like, oh yeah, I'll do that. Lots of talk in this industry in a lot of different ways. But I would always end it with, hey, I'm not going to be able to earn your trust today, but I'm really looking forward to earning your trust over the next 6 to 12 months and showing you I will do what you're asking. And I think that's one thing that just when you say, don't be transactional and actually get to know somebody, I think that's a piece that gets missed here.
Yeah.
Is many doctors are always having somebody come to them for something, always. And I learned that being a personal trainer, I trained a lot of surgeons. And what I've learned is they all have life, they all have relationships, they have kids, they have challenges in their own life that sometimes just a new perspective can be really, really nice to them and a breath of fresh air.
I mean, that's so insightful. And I think that, aside from taking care of patients and wanting, the best technology for the patients as well, a lot of these, customers might want to be innovators or KOLs. And if you can kind of unpack that that's what they're looking for, you can help them in that way and help, there's a win-win situation right there. I think, a lot of doctors don't know what to do if they have an innovative idea. And I know of our own OU, our own operating unit at Medtronic, we've had, physicians suggest their innovations, and we've then co-developed, a new device that's come out of a certain conversation like that. So you never know like what that could lead to, and you're helping those doctors understand that process because many of them don't.
Yeah, I think that's something that's really big is there's so much, like you said earlier, that goes into the medical world and like medical device world and all of the different processes that you can go through, whether it's like creating a new product, whether it's being a KOL, whether it's if you're the rep trying to get new trials, like there's actually steps and processes on how things happen. And I think just even educating yourself and helping them will take you to a whole nother level, because that's one thing you're amazing at is if you know someone, you're like, hey, let me just get you connected, or hey, let's be able to help you out. And I've watched you do that when you're talking with people, and it's absolutely amazing. And I think when you're able to say, hey, how can we make it a win-win situation and everyone wins? That's what most people, I think, miss, especially in the medical device sales world that I see. It's about me. We all know the reps, or we hear about the reps who overpromise and underdeliver. And my advice to all the reps that are going to watch this is underpromise and overdeliver. That's what I've always said to everybody. And always, maybe the stuff's going to come in 2 weeks. Say it will come in 3 weeks. And then when it comes early, you're the savior. And then guess what? They might be mad that it's 3 weeks, but you work with them. But I always say this because I think there's a lot of uneducation or uneducated opportunities in this space that many people don't truly understand, that if you can just help them understand, like you said, what's the surgeon really trying to get out of it? Whether it's the product, but also in their career. One of the best questions that I loved asking is what I asked you is, what's your why? What's your why to medicine? Why'd you go into medicine? Because like you said, I'm seeing it and I talk to them. I see the burnout. It's actually crazy. When I was a personal trainer, one of my favorite questions I would ask is, if you go back in your life, would you redo this? And the answers I got from those professionals was always very interesting to me. And so I think when you get to know people on a personal level, it can take it to a whole different opportunity for you and your business and for them.
Yeah. I mean, it sounds so basic, right? But really, your customers are people, like you're saying. It's a bi-directional, kind of relationship. It's not just, a unidirectional take situation. So, just even reframing it in that way, hopefully can help some people, have more success.
Yeah. And when we're talking about success, you've had a lot of it. And you're still extremely young from where all the positions that you hold, which is absolutely amazing. For you, with all of the success that you've had, what have you learned through that journey?
Wow. I think it's interesting because despite a lot of what I think people would define as success, I still feel like, gosh, there's more I can give and there's more I can do and there's more people I can help. And I think that ultimately that's kind of the drive that maybe takes me to more places. I would also say a lesson that I've learned is that I really need to kind of take a pause sometimes and just like celebrate the wins. I have historically not done a good job at doing that, honestly. I just kind of am so stressed out up until the moment that something, happens that I don't, I forget to actually celebrate that moment and take it in. Which again sounds so basic, but I feel I'm trying to be more deliberate about that, and acknowledge that, So I think that taking those moments in, I think can hopefully, help me go longer and not get too, strung out by that drive.
Well, I think that's extremely powerful for the fact of most high performers never feel like they make it. And then one thing that I've watched is that the goalpost continues to move. And like you said, won't take the time to actually even take an afternoon or a couple of hours of saying, hey, wow, this is what I was hoping to accomplish and I did it. Because what's interesting with high performers is we actually expect it. We expect the goal that we put out to do. And then we put in so much work that it's just going to happen and we expect it. And so when it happens, it's more like you're saying is you expected it to happen. And then we don't actually take time to be like, wow. And I think what you're saying is such a powerful tool. If more people did it, they would actually go way farther in their career and faster. Because when you actually look back of where were you 12 months ago? And what are you the most proud of over the next 12 months? And it might not be professionally. It could be personally. But being able to have a check-in, one thing that I've continued to try to do to this point is every month, but especially every quarter, I have a check-in with me. I schedule a time to go and just write in a journal, reflect, talk about the last quarter, talk about what I'm excited about, what I'm not excited about, things that I wish I would have done better so how I can continue to grow. And I think what you're saying is as you continue to go through this journey, appreciating the journey and where you've come from to where you're at and where you're going, it just makes it more fun.
And if I may add, I feel like also taking time to appreciate that often getting to a certain goal or achieving that success, it's not a one person journey, right? There's so many elements that have to fall into place to be able to make that happen. So many people involved. And, if it wasn't for so many amazing people supporting me and helping me in certain ways to get things done, none of this would even be possible. So, I have to remind myself as well, of that and make sure that I, show that gratitude too.
And this is what you're so good at. And this is why I really admire you, because of course I watch your social media and I see you do that all the time. You always point your success to other people.
Oh.
And it's so much fun to watch because, like you said, we a lot of times can think we're doing it, but without a team, without other people, we want to be half the places that we thought we could be. And I think you're just so great at that. And I hope people take that, the listeners take that, is what I've watched the best leaders do and the people who are usually in positions that a lot of individuals are like, how they do it that fast or how they get it. It's usually because they're the most humble. And they actually deflect when people want to say, hey, you're amazing. It's all like, no, these people got me to be here. I'm just thankful to be here. And it's actually interesting to watch.
I mean, honestly, it's because it's the truth. Like if people didn't give me the opportunity to do certain things, I wouldn't be here. I credit my boss for giving me opportunities to allow me to keep doing what I'm doing, et cetera. And yeah, I do feel like humility is a part of that. I remember asking our CEO, Jeff Martha, what the 3 kind of most important traits of a good leader are in his opinion. And he said, one of them is humility. The others being clarity of thought. And the third one, I've got to think about the third one. The third one was purpose. Yeah. So purpose, clarity of thought, humility. And the fact that he included humility in that, I think really told me a lot about, how he approaches things.
Yeah. And I think that's actually really amazing. Even again, talking about where you're at, that you can actually have those conversations with Jeff, the #1 medical device company in the world, CEO, and being able to learn from someone like that, because
so fortunate.
he's accomplished so much. And again, he's young for everything that he's accomplished. And I think that's what I really love about what you're all doing at Medtronic is you continue to change the world, but you also continue to have such amazing people who want to give back in so many different ways. And I can say that because I remember working at Medtronic and I remember being like, wow, this place is different because this is a place where people come and they stay. And so it's really amazing to see where Medtronic continues to go. Now, one of the last questions I want to ask you is to the people watching, whether it's the pre-med student considering, hey, maybe I want to go and be a doctor and change people's lives, or it's the surgeon who's already in, or it's even someone who wants to get in medical device sales or wants to be a rep. What's your advice to people who are watching this and being like, maybe I want to do something else, or maybe I want to continue to grow, because you've grown so quickly and made a whole life for yourself where people are like, look at Austin. So what's your advice to those people?
My advice would be to, check in with yourself, do a lot of soul searching along the way. And you will evolve as a human being, and your path doesn't have to be the same one forever. And, if you're interested in a certain path, if you're a pre-med student looking to go into med school, you can do that for a while and then you can pivot, or you can take that expertise and apply it in a different way. And so you can, to a certain extent, you're in charge of your own destiny in that way. And just be open-minded about that. I mean, I had plenty of med school classmates, I think, who went in with a very specific goal in mind. And sure, that will get you to a certain goal if that's truly what you want. But I think that you might be so pigeonholed into a certain path, and you might have your blinders up and not be as receptive to other ideas or opportunities that might come your way. And so just be open to that and be open-minded. And like you said, travel more. Because that'll open your mind further and expand your horizons, and give you a different view on how to approach situations, how to approach a career, how to approach your life.
Yeah. Well, I think that's going to be the favorite part of this whole podcast for most people is they just got told they need to go travel more. So Austin told you all to go do
Travel
that.
more, talk to people. Yeah.
Now, how I want to end this is you've accomplished so much at such a young age. As you continue to grow and you see your career and you look forward to it. For you as an individual, what are you the most excited about in the upcoming year for yourself or even the next several years?
To put it vaguely, I think what I've realized over the years is that I've taken a lot of different interests and found a way to sort of converge all of them. And I think I'm going to continue to pick up different interests as I explore more and, again, keep an open mind and be naturally curious. I'll find even more ways, I think, to weave it all together. And I think that that's where, we can do something really cool and magical is when you take these different experiences and different expertise and put it all together in a way that we haven't seen before. So we'll see where that takes me. But I think that that's what I'm very appreciative of, in the role that I'm in now is that I'm able to, take bits and pieces and incorporate that. And I think ultimately, when you look at some of the top leaders in our industry is that they've also done the same thing as they've collected a lot of experience along the way and been able to, provide this perspective that's so comprehensive and broad because they've seen different ways of doing things and hopefully I can one day do the same.
Well, I have no doubt that you're going to do that because you're already doing so well. And I just want you to know, thank you so much for taking time to just come on to the podcast because again, I remember sitting in the Subaru talking to you 4 years ago, us talking about TikTok to where you're at today and everything you've accomplished. And I just really appreciate you coming on to share with our listeners and share a little bit more about yourself and how you've continued to have so much success that I know it's going to be helpful for a lot of people. So thank you.
Thanks for having me.